I know you're going to add it, so I'm just going to talk to you like I talk to you, okay? I think the media people that are here know that going on 12 years as a mayor, I don't call press conferences. I think maybe in 12 years, you would know, maybe 2 times, 3 times in 12 years. Especially on a Saturday, especially on a very last minute time. I don't know how long ago now, longer than 2 weeks. And even before that, when we first started, this was the first information we got on the veterans home. First information we got was that 2 staff members and a resident. And shortly after that, a fatality. And see Talmadge standing back there, he knows. From the very, very beginning in February, we said our goal is to protect those who need protection the most, in regards to the seniors at that time, and try to get through this without any fatalities. How elated we all were in every announcement from way back. No hospitalization. We didn't even use the word fatalities. It went for weeks and weeks, and finally we had one, but that one person was from out of state and got admitted to a hospital here. And then the purpose of this press conference. Many, many, many years ago, when Senator Inouye submitted an appropriation for a veterans home to the state of Hawaii, Hilo, Hawaii. He wanted it in Hilo, specified in the appropriation. And then there was a battle in regards to the matching funds and legislatures or people at the state level trying to get it in Honolulu, and the veterans here rallied that it should be here in Hilo. I was the beginning mayor then, just to help because as mayor. You know what we promised? We promised to give it to Hilo because Hilo will embrace his home. Hilo will make the veterans feel welcome on their home. We will make them feel they're very welcome and very appreciative. And here I am calling this press conference because I truly feel I asked for trust, and that trust was broken. It's been some time now that I appealed to people of the state of what was happening at the veterans home here. The latest news of this morning of more being infected, residents as well as staff. Information in the past 2 days of up to 10 fatalities, all from the veterans home. You scream out and say, this is not acceptable. How can this be? That progressively it goes on and on. And of last week, finally, they said they would send someone And on this past Wednesday, last Wednesday rather, I don't even remember dates anymore, because the review was made. This is Saturday, and they would come back this past Friday, Wednesday, Friday, for another review, to complete that review. Colonel Yazawa in charge, representing the state. A review meeting was held yesterday afternoon with a team of Veterans Affairs people and Colonel Yazawa, Dr. Yazawa. And when they gave me the report and I asked the question, so where do we go from here? And the answer was, we will go back home, make a report and send it to them that says that these things must be addressed and corrected, and we will come back in a few days to see if you have made changes for the better. And yesterday I said, totally not acceptable. Absolutely not acceptable. And anyone there will tell you that I said, if you were under my command, you wouldn't even go home. You would do whatever we can from here on in, which is already way too late for what we should have done at the beginning. To immediately suspend the present administration until the review is completed, and in the meantime, replacement administrators to correct all the wrongs now. I am not saying this and calling this press conference behind anybody's back. I said I would do this, and that's what we're doing. What is happening and what is happening is a sadness to the families and the veterans that are there that cannot ever, be corrected. The only thing I hope for now is that we will prevent any further harm. Long time ago I said that, every time a country asks people to go to war, we're obligated to give them the best training, the best equipment possible, and if they're lucky to come back, our responsibility is to care for them. A lot of promises were made when we fought for this veterans home here. And to families that were affected and to veterans who look upon this as what happened, no apology is going to even say remotely what you want to say or what you feel. As I told staff, the only thing we can do now is from here on in. So yesterday at the press meeting, I said, I will do this. I will do this for one purpose, and I'm using you, the media, because in that way, I felt I would get the public support and therefore, hopefully, the action. That I should not be standing here calling this press conference, and there should have been people up there trying to correct the wrongs that was already pointed out. Already pointed out. The first request that they were going to come over was week before last. And you had to wait until a Wednesday. This past Wednesday when it came, you had to wait for Friday to follow up. And now to expect the veterans and the families to wait till next week and wait for what? A response by them that these are the things. I end this press conference with this. I'm not speaking behind anybody's back. I don't like grandstanding. I don't even like this press conference. But we made a promise and we did not keep it. And this is what this is all about. Thank you.
Any questions, gentlemen?
Are these changes already in effect, or if so, when will they be in effect?
That's what it's the whole thing about. If it was in effect from initial, this press conference wouldn't be held, except to say thank you. This press conference, as I said, is being held because the response was non-acceptable on timing, and even on that timing, non-acceptable of still waiting for correction to be made. These should not have been requests for, this should have been a demand for these to be addressed. And I've stated from the first day they shouldn't have been allowed to go home as far as evaluators. Any other questions?
I have a question. We've been trying to figure out using state data. They keep reporting 3 deaths, but we here know that number is higher. Any indication why that number keeps getting repeated on the state's end?
Well, it's a paperwork procedural thing. Basically, it's this, that the state Department of Health cannot officially classify a death as food cause until they receive all the medical records and those things. And so they've only gone through, I think, 3 or 4 of them at this point, and awaiting word, receive all of the data. However, for those people at the hospital that submitted, they submit cause of death. And so you have the 10, but the paperwork follows after that.
I have a question here from Mahia in the newsroom, Mahia Lani, which says, please have the mayor explain who is responsible for the home, Avalon, state, or feds?
The Avalon facility and the property belongs to the state of Hawaii. It was built there, funding by the federal government, appropriated to the state with a matching fund request. And so therefore the facility is the state of Hawaii. The program itself was decided by the state way back when that they would contract this out. Even at that time, record would show that I didn't support that. I felt that it should be of people that of here, meaning the state hospital. So I felt a better attachment to this facility and the program. So the contract was made and Avalon was given that contract. So the control of that contract is with the state government.
Thank you.
You've been critical of the Veterans Home in the past, but recently, not as much. Have they been progressing in a positive direction in recent years, do you think? Or?
No, I wish it was that. It's an excuse, I know that, but somehow you prioritize what you need to do. You're the mayor, and this is under the state government and federal government, and the truth is a belief that professional people are doing the job, and the confidence that and hope that a good job is being done. And you just believe that. It is only since of the virus and the consequence of positive cases and deaths that you got back in it. I know it sounds like an excuse, but really Yeah, sometimes you get so much wishful thinking and everything. You make assumptions that this was well taken care of. And I made assumptions that I was so proud of our hospital system, for example, of response, and I just thought this would be the same.
Is the county helping anyone to proactively look at any other nursing homes and stuff like that on the island to make sure this doesn't repeat elsewhere?
Yeah, from the very beginning, when the information came out in regards to coronavirus, and knowing how little we know about it at that time in early February, I think most of the information being circulated nationwide was that those with underlying health problems, especially the elderly, was the most vulnerable. And even some belief that the youth was not going to be affected so much. And so the County of Hawaii made a pledge in regards to working with all of the long-term care of the private sector and the individual homes. And I'm proud of the work they did. But on the level of the state government, I felt in a way that they were in good hands. And on that, I would say this, we have some long-term care programs here like Halea Nui Nui and the one in Kavalani. They're much bigger programs than the Veterans Home, and I'm proud of them in regards to where they are today. So apparently they did a very good job and continue to do.
Since we have you here, any news about Miloli'i? Anything new down there?
We went down to Miloli'i today, right?
Yeah.
On Miloli'i, because the information of a cluster, we tried to work with Department of Health in regards to review where all the cases are from. And it was found through testing that individuals went. There was a small cluster indicating they're from Miloli'i. And so arrangement was made with the community's participation in trying to test everyone. And that was done first, Talmadge, you remember the date? Saturday before.
Yeah, so a week ago.
A week ago, our testing task force went down. So far, I don't think we have any real positives from that. We went back as a follow-up today. And I have to take this opportunity to thank the community for embracing, because the house-to-house was already made in the old Miloli'i village, and face mask distribution was made. And so it was a very good, relationship thing. And we will not get the full results. First of all, today's test, we're not going to get the result for 3 or 4 days, hopefully on the outside. But so far on the testing done last Saturday, we've had no positives come back.
Any response, sorry for this question, but any response to the unfortunate news that the Lieutenant Governor tested positive? It came out last night.
My response for me when I was told yesterday by Mo's staff member here, it shows you how whoever said it, the virus has no prejudices. Could care less if they're the Lieutenant Governor. Not to make fun out of that, but it's a lesson for all. Him being a doctor, I'm sure he was careful. He knows he has to keep himself healthy. I know Josh for a long time. Just shows you how we all have to be very careful all of the time. And I wish him well.
This is my last question. I remember back a couple of years ago, the governor consulted you about issues at the emergency management agency at the state level, and you provided some good input for him. Have they consulted you about the health department issues that seem to be occurring right now?
No, the consultation was number one, if you remember, of the missile crisis. Number two was a replacement of people that were going to be relieved. And I think it's known that I recommended Tom Travis, because I know him from a long time ago. And grateful that the governor, asked him to come. Thomas, left. Outside of that, now in regards to what we're doing, and yes, way back when I did talk to the governor about the importance of a centralized command system so the state would not be splintered on who does what. So we did talk about that. Thank you, everybody. Appreciate it.
Gentlemen.